What is an infection? An infection is when the body has been invaded by germs. It can be localized or systemic. The germs can be bacteria, a simple cell structure containing genetic. They live everywhere and all are not harmful, such as bacteria that live in the digestive system. They include Salmonella and tuberculosis. Virus. They are only alive by finding a host cell to live on and reproduce. They include rubella and smallpox. Parasite. Live in or feed off a host such as tapeworm or mosquito. Fungi. They are found in any habitat and cause many skin surface infections. They include athlete's foot. Infections can be spread in numerous ways. Direct contact. Person to person, this can be via touch or transference of the bodily fluids via coughing, sexual intercourse or sneezing. Animal to person, this can be via scratch or bite. It can be through coming into contact with urine or feces. Mother to unborn child, this is passed through the umbilical cord, placenta, breast milk or vaginal canal. Indirect contact, this occurs when an infected individual touches an object and leaves their germs, usually through poor hygiene. Then the next person touches the same object and picks up the infection. Insect bites. An insect bites an individual and passes the infection on, such as malaria. The carriers are known as vectors. Food contamination. Contaminated food or water is infested and the infection is passed on. This can be via dirty water, uncooked food, such as E. coli. Lines of defence. First line of defence is the body's physical and chemical barriers. The integumentary system is the largest body organ and provides a physical barrier between the external and internal environment. It includes the skin, glands, hair, nails. The skin is the key barrier to defence. It has three main layers. The epidermis is the tough outer layer of the skin and provides the first line of defence. It constantly regenerates. Dermis is under the epidermis. It contains the blood and lymph vessels, nerves, sweat glands and hair follicles. The subcutaneous layer is the deepest layer. It is made of fat cells, connective tissues and provides insulation from temperature changes. The skin helps too. 1. Maintain body temperature. 2. Provide a defence against pathogens. 3. Prevents excess water loss. 4. Provides defence against UV damage. 5. Provides defence against toxins and irritants. Other lines of defence. Mucous membranes. Line many surfaces in the body, such as the eyes, ears, nose, throat, GI tract, respiratory tract, and urinary tract. They release chemical secretions to stop the development of microbes. The mucus also help trap pathogens. The membranes allow nutrients to pass through. Nasal cavity and airways. The mucus layer helps trap pathogens. The cilia help move the mucus in waft-like movements and together help filter matter. Immunoglobulins help prevent pathogens sticking to the mucosa and are expelled from the nose. GI tract. The intestinal epithelium provides a barrier to pathogens. Stomach acid, bile and pancreatic juices destroy most pathogens. The acidity in the stomach is low and destroys most harmful bacteria. Peristalsis helps to remove the waste and harmful substances from the body. Urinary tract. The urethra is long enough and meant that the bacteria cannot pass through to the bladder. Women are more prone to infections from the bowel due to the shorter urethra. Urination helps to excrete pathogens. Female genital tract. It contains columnar epithelial cells that provide a barrier to microbes and antigens. Estrogen and proestrogen regulate the immune cells. Proteins such as lysine are secreted to defend against infection. Second line of defence. This is a range of non-specific responses. They do not differentiate between the different types of infection and respond the same way each time. The defence mechanisms involves inflammation. There is an increase in number of white blood cells at the affected area. Fever. Body temperature is increased to prevent bacterial growth and help immune cells to work faster. Phagocytes. Large white blood cells move to the infected site and engulf the foreign body or infection. Complement proteins help break down and remove pathogens. Cytokines. Small proteins stop the reproduction of viruses. They are numerous. Interleukin, which targets leukocytes. Monokines, produced by monocytes. Lymphokines, produced by lymphocytes. Interferons, which are then produced when there are viruses. The inflammatory response. The diagram demonstrates the inflammatory response. The inflammation occurs because the damaged cells release chemicals such as histamines, and the chemicals cause blood vessels to leak fluid into the tissues. This causes the swelling, redness, and heat. The swelling helps to contain the foreign body and prevent it contracting other body tissues. The chemicals also encourage white blood cells, phagocytes. These eat the germs and dead or damaged cells. This is known as phagocytosis. The phagocytes die and pus is formed in the collection of dead tissues, bacteria, and both live and dead phagocytes. Phagocytosis. Monocytes go to the area of the infected tissue and after a series of changes become macrophages. Macrophages are white blood cells that can modify and engulf and destroy target cells that do not have proteins that are from healthy cells. Neutrophils are white blood cells which also kill and digest bacteria and fungi. They also release cytokines to attract more immune cells. Third line of defense. A pathogen is a microorganism that causes disease and an immune response, and bacteria and viruses are pathogens. They infect the host and reproduce if it's a virus, replicate. An antigen can be part of a pathogen and is any substance that causes the immune system to produce antibodies. They can be a protein, carbohydrate, nucleic acid, or a fat. Examples of antigen are the proteins found in a virus. Acquired immunity is something that is not present at birth. It develops when the immune system responds to either a microorganism or a foreign body, active, or as being given a vaccination, passive. The immune system learns the antigen and how best to respond and memorises it in readiness should it occur again. Artificial immunity reacts rapidly to fight off infection, and the person probably doesn't even realise there's been an infection. Neutrophils. Most abundant and able to renew lysosomes, dies quite quickly after phagocytosis forms most of the pus. Lymphocytes produces antibodies to target antigens on pathogens, more prevalent in lymphatic system, includes B cells, T cells, cytotoxic T cells, and natural killer cells. Monocytes, largest and conduct phagocytosis, long-lasting and renew lysosomes for continued digestion. Differentiate into macrophages and dendritic cells. Macrophages remain in tissues for phagocytosis, but dendritic cells send antigen fragments to lymphocytes. Eosinophils, prominent to allergic reaction and parasitic infections. No phagocytosis, but release chemicals to perforate cell membrane. Basophils cause inflammatory response by releasing histamine and heparin, contribute to allergic response and circulate in bloodstream. The acquired immune system. The acquired immune system is very specific to the particular pathogen introduced. It provides a lasting response. For example, if a person contracts chickenpox as a child, they are highly unlikely to contract it again. This is because the immune has created a response and remembers a pathogen through the development of memory cells in order to fight it should it reoccur. This is predominantly completed by the lymphocytes T and B cells. T cells make up 80% of lymphocytes. Called T cells because they're produced in the thymus. There are 3 types of T cells: cytotoxic T cells, suppressor T cells, and helper T cells. Antigen presenting cells, otherwise known as APCs, break down the foreign body, and part of it is presented to the T cell to trigger a response. The ACPs also have a molecule on the surface which triggers the helper cells, and this in turn triggers the release of a large amount of T cells into the bloodstream to destroy the foreign body. T cells are triggered by substances released to the bloods, and B cells are triggered through contact with T cells. The functions of the T cells are activate B cells in their growth, activate cells that phagocytose foreign bodies, during a viral infection stimulate cytotoxic T cells, and signal growth in cells such as eosinophils, macrophages, and other T cells. Helper cells regulate immune function and antibodies only mass produced appropriately. Required for almost all acquired immune response, make up 75% of T cells, helps B cells grow and develop, triggered by lymphokines, activates cytotoxic T cells. Suppressor cells stops overstimulation of the immune system by blocking the action of cytotoxic and helper cells. Cytotoxic cells defend against viruses, reject skin grafts, and can provide immune response to some cancers. Activated by ACPs and helper T cells, induce apoptosis, program cell death to kill target cells, produce perforin to perforate cells and only affect that specific cell and not others around it. B cells and humoral immunity. This is an antibody-mediated immunity where B cells produce antibodies against a specific antigen. B cells got their name because they were discovered in the bursa fabricus in birds. Each B cell produces a specific antibody where there are millions of different B cells. They form memory cells after activation. They give signals to activate T cells and present antigens to them. A memory cell can recognize a previously encountered antigen to provide a quick immune response. Plasma cells make a large amount of specific body and are developed from activated B cells. Immunoglobulins and antibodies. Proteins bound to antigens. The roles of immunoglobulins and antibodies. They target the infection, they bind to and neutralize foreign bodies and toxins, recruit immune cells, facilitate phagocytosis, remove antigens, complement activation, and activate mast cells. Structure and type of antibodies. Generally made of 4 chains, 2 being of larger mass, heavier shaped and are white. There are numerous types of immunoglobulins. The IgG makes up 75% of the immunoglobulins and activates attack on any foreign body. It can tag a pathogen for their immune cells to recognize, or can trigger release of toxins to destroy, can trigger unwanted effects in autoimmune diseases. The IgA, produced by B cells, make up 15% of immunoglobulins. It tags pathogens and prevents them sticking to the epithelium found on the mucosal lining. The IgM, made of 5 normal immunoglobulins joining at the base. The first antibody made in the immune response, developed quickly, but numbers plummet when the IgG takes over, helps B cells develop memory cells. The IgE, responsible for allergic response and aids protection from parasites, produced by B cells and lymph nodes. The IgD, binds to B cells to trigger immune response. Recognizing self and non-self. The immune system is able to differentiate between the self and non-self, thus preventing it attacking its own cells. The complexes 1 and 2, human leukocyte antigen gene complex are what enables the immune system to have this differentiation. When new antigens are present, T and B cells are triggered. The level of response is dependent on how different the antigen is to the self-antigen. Hypersensitivity is an exaggerated or inappropriate response to an antigen or allergen. Autoimmunity is when the body's is when the immune system makes it healthy tissue and attacks them as if they were a foreign body. Self-tolerance is the immune system recognizing self-antigens and not attacking them. The immune system kills self-reacting lymphocytes. If this fails, T and B cells can become activated against these self-antigens. Rejecting transplanted organs. A transplant is the transfer of cells, tissues, or organs from one person to another. The immune system identifies any transplant as a foreign body, and a non-self initiates an immune response. It is important to ensure that a transplant is as near a match as possible to prevent the immune response from rejection. The only exact match will be from identical twins. Monoclonal antibodies are given to reduce T cell attack and thus rejection. 3 types of rejection are hyperacute, acute, and chronic. Autoimmune diseases, rheumatoid arthritis, RA. This is a chronic inflammatory disease, predominantly affecting the joints, but can also affect the eyes, skin, lungs, and heart. Diagnosis: blood test to identify inflammation, ultrasound, X-ray, MRI to identify RA, and inflammation of synovial tissue, bone damage, narrowing of joint space. Physical examination, medical history. Effects on the immune system. The immune system attacks healthy joint tissue, synovial, predominantly in the joints. This causes swelling in the joints and consequently pain. Effects on the body. The synovial tissue becomes inflamed, pannus tissue develops thickening due to diving synovial cells, cartilage and joint tissue damage. Sore, hot, swollen joints. Many smaller joints such as hands, but as disease progresses, other joints become affected. Joint stiffness, tiredness, temperature and loss of appetite, weight loss, flu-like symptoms. Early rheumatoid arthritis tends to affect your smaller joints first, particularly the joints that attach your fingers. Joints can feel spongy when pressed. Other areas that may be affected includes skin, eyes, lungs, heart, kidneys, nervous tissue. Treatment. Controlled symptoms, usually analgesia, anti-inflammatory drugs, corticosteroids, biologics, topical pain relief, positive lifestyle habits, dietary changes, relaxation, sleep, healthy relationships, avoid smoking and other toxins, surgery to replace or fuse joints. Flare-ups. These flare-ups can be triggered by many things such as stress, flu, injuries, surgery, certain foods. The flare-up can last from a few days to weeks, and symptoms may become much worse. Remission. There are many times when the symptoms can reduce, you can feel better and it feels like the RA has gone away. Inflammatory bowel disease, IBD. This is a group of disorders including the ulcerative colitis and Crohn's disease, which cause severe inflammation of the GI tract or part of it. Crohn's affects any part of the GI tract from mouth to anus. Ulcerative colitis affects the colon and rectum. Diagnosis: blood test, stool examination, colonoscopy, endoscopy, sigmoidoscopy, and gastroscopy and ultrasound. Effects on the immune system. The immune system mistakes food as foreign substances, sets off an immune response and releases antibodies to fight, causing IBD symptoms. Effects on the body. Abdominal pain, diarrhea, sometimes alternating with constipation, with urgency. Wind and bloating, loss of appetite or unexplained weight loss, mucus or blood in stool, upset stomach. IBD may also cause tiredness, temperature, itchy, red and painful eyes, joint pain, sickness and vomiting, skin rashes and ulcers, vision problems. Treatment. Anti-inflammatory, biologics, corticosteroids, immunomodulators, anti-diarrhea drugs, bowel resection, no resection, colostomy, or flare-ups. The reappearance or increase in severity of symptoms occur due to the inflammation of the GI tract. This can be due to not taking medication, diet, stress, toxins such as nicotine. The flare-ups vary in length and depend on the cause of the inflammation. Remission. When the IBD is inactive, the immune system is working well and not attacking self, and inflammation reduces in the GI tract. Natural active immunity. Active natural immunity is when the immune system responds to the pathogen. The T cells attach to the pathogen and present it to the B cells, who produce antibodies to destroy the pathogen. The B cells remember this antibody and therefore create a lasting immunity. For example, when measles is contracted, the above process occurs, the antibodies are remembered, and if you come into contact again with measles, your body has produced immunity. Artificially induced passive immunity. A person generates an immune response from being exposed to a vaccination containing specific antigens. The vaccine stimulates the immune system to produce antibodies and memory cells to the antigens in the vaccine. The antibodies are then present should an individual come into contact with the same antigen. Passive immunity. Passive natural immunity. This is when antibodies are passed from one person to another. This can occur via the placenta from maternal to fetal blood and breastfeeding. Eventually, the child's own immune system will take over. Artificially induced passive immunity. This is acquired via injection or transfusion of antibodies made by another. It only lasts a few weeks as the antibodies break down and are not replaced by the individual's immune system. A vaccination is a weakened version of a pathogen which is given either orally or injection to stimulate an immune response to develop antibodies, thus providing long-term protection. They contain live and dead pathogens, fragmented parts and toxins produced by pathogens. Live vaccines are weakened and the body must replicate them through the immune response. They do not cause symptoms of the illness. Immunological memory. This is when the immune system develops memory cells and responds quicker to the previously encountered pathogen. The primary response is when pathogens are encountered for the first time, B cells identify it, and plasma cells produce the antibodies. Infection and symptoms may occur. Memory cells are made in the readiness to respond to another encounter. Secondary response is when the pathogen is encountered again. It is not time dependent. A high amount of antibodies are produced quickly and for longer to fight the pathogen without any symptoms occurring. Herd immunity. Disease and infection can be spread from person to person. Herd immunity is when a large number of population or community is immune from a specific disease. Herd immunity occurs because if enough people are immune to the disease and has nowhere to go or spread, it provides an overall protection and the infection rates drop. Herd immunity can occur naturally or through a vaccination program. In natural herd immunity, a large percentage of the community have been exposed to the virus and develop antibodies. Acquired herd immunity occurs through a vaccination program. The number of people requiring vaccination or acquired herd immunity depends on the disease. Herd immunity does not protect against all vaccinated disease. Tetanus is not passed from person to person, but via bacteria in the environment. Difficulties of herd immunities. Failure to produce an immune number. Infection may occur before immune response. Refusal to have vaccination. Immune system doesn't pick up pathogen. Pathogen may mutate. And different varieties of the pathogen. Each disease affects a threshold to vaccination differently, depending on symptoms, rates of transmission. To calculate the threshold for herd immunity, a basic reproduction number, the RO. The RO represents how many people an infected person could pass on the disease onto. Factors affecting uptake of vaccinations. Safety concerns. This was very evident with the MMR vaccination. Michael Wakefield produced a report in 1998 stating that MMR caused autism. This caused a large drop in intake. It was then found the research was invalid and fraudulent, but it took many years to overcome the effects. Accessibility. Previously, vaccines were only available at the GPs and within work hours. Now they can be obtained from pharmacies and for COVID at vaccination centres. Anti-vaxxers. This has become more prevalent since COVID and the use of social media and scaremongering. People cannot have the vaccine if they are unwell. Seasonality. This relates to disease that are more prominent at certain times of the year. For example, the flu vaccination is given every autumn in readiness for the winter months. Benefits of vaccinations. Eradication of disease. Smallpox was eradicated in 1980. Polio now only has cases in Afghanistan and Pakistan. 200 million deaths prevented, have been prevented from measles. It's been eradicated in the USA, but unfortunately there are still cases across Europe due to poor coverage. Childhood mortality has because of the eradication of diseases and immunity against MMR, etc. Childhood deaths and serious illnesses have vastly reduced. Many children suffered terrible lasting effects of diseases such as deafness, blindness. Unfortunately, as previously discussed, many parents chose to risk their child getting MMR rather than inoculating because of a false fear of autism. Gladly, this has been unfounded and the uptake is increasing. Unfortunately, many anti-vaxxers affected uptake of the vaccine due to their unfounded conspiracy theories. It has not yet been established where the threshold for herd immunity is. COVID. The COVID pandemic has clearly shown the advantages of immunisation. Many extremely clinically vulnerable people with underlying health illnesses died as a result of COVID in the first wave. Once the vaccination programme rolled out, infection rates demonstrated less severe impacts on health. Reduction of cost and time in the NHS. Vaccinations help prevent hospital admissions and time spent at GPs. Resources can be spent elsewhere. It is easier and cheaper to prevent a disease than it is to treat it. Reduce antibiotic resistance. The WHO in 2016 stated that vaccinations reduce the development of illness and thus need for antibiotics. This will help reduce the resistance of antibiotics to certain infections. This will also positively impact on helping reduce the cost of the NHS. Reduce cancer. The HPV vaccine helps to reduce the infection and development of cancer. However, at the time, some worried it would increase promiscuity. Studies have found this not to be the case. Empower women. Vaccinations reduce infant mortality and thus reduce the amount of children women have to bear. This can affect the woman holistically and improve her social and mental outlook. The immune system is a complex and yet highly efficient system in helping defend the body from disease and infections. It is evident that vaccinations have become a necessary support to help reduce or eradicate disease. This has been clearly visible during the COVID pandemic. Before the vaccination programme, hundreds of thousands of people died or were left with serious illnesses. After the rollout of the vaccination, deaths reduced and the symptoms were more tolerable.